like you don't want to touch it. And this is also thanks to the technology. So my presentation actually is, about old ceramic and CAD/CAM technology as an ideal combination for great aesthetic success. What that means that maybe, yes, talent is very important, but maybe you can get to a great success also without the need of a super talent. Having said so, let me see, this one is to change. What we can say, yeah, this is a nice bridge, but yesterday I saw the old bridge in London here, and it's really make this one so small, and tiny. Anyway, the point is that today I think it's much, much easier to achieve excellent aesthetic results. And we see that in every cases. Now I will just get a simple case to show you and to see what I mean by that. This is Elisa. She is from Florence, like me, and what you see in the back is my town. It's a nice and peaceful town, but traffic in Florence, it's worse than in Manila. And so to go around, we go by moped, and we get our way, Sometimes things happen and, accident happen, and that's what happened to her. Common things. It happened to, you have a lot of patients that come because of an accident. She did not lose her smile attitude, but unfortunately, she lost some teeth, the 3 frontal teeth. And Elisa, she was very proud of her smile. Something that for us probably is not perfect, because we see many things. We see that, teeth are not aligned, the gingivas are not perfect, but that's our point of view. For the patients, sometimes they don't care. She did not care. She was very happy with what she had, and so she pleased us to do exactly, replicate what she had before. She was happy before, she wanted to be back happy after. So, just to make this long story short, after the clinical treatment, she had to go through 2 endos on 2 centrals. Then we had provisionals, impression, and glass ceramic work. What I want to show you is that what we got the same color. I have 2, I have to understand which one I have to use. We were able to get the same shape. We were able to get the same values. And of course, we were able, that was the easiest part, to get the same levels. And the material is so beautiful because, the translucency is so nice. Therefore, at the end of the day, we got what is called a great success, because she's very happy, we are happy. She's not driving the moped anymore, but we got what we wanted. Now, what is the point? The point is that all ceramic helps. Yes, you have to be talented like Murillo, but if you use the right materials, we can get very close to it. And why the ceramics, all ceramic helps? Because this material is so nice that it's very hard to see it when you have it in the mouth, because it integrates so well. And it makes it easier for us, especially when dealing in the so-called aesthetic sensible areas. You can make a crown and to become invisible. From the technical point of view, also, it is much, much easier for us as a dental technician to do a build-up in a natural way. Because with this material, I can concentrate is to first build up the dentin core. And then, when I'm done with the dentin core, I can build up the incisal, exactly like anatomy made it. Now, this is a very nice technique, and I do not have the time to explain it, but I can suggest you a beautiful book made about Oliver Briggs. And Oliver made such a... Where are you, Oliver? Where are you? There? Okay. You made such a great book. It has everything in there. And it's so nice that I keep it in my backyard just as an ornament. It has everything about old ceramic, e.max and zirconia. Beautiful. Thank you, Oliver. Yeah, he deserves it. Also, this morning we saw monolithic crowns. That's another great thing about this material. The material today, it is so translucent, that is so beautiful. And look at this, just try in. They already blend inside. You feel like you don't want to touch it. And this is also thanks to the technology. Because today we have new generation, it's the 4th generation of pressable furnaces. These furnaces work so well, it makes your ceramic so precise in the pressure and smoothness of the translucency of the material. It makes it easier to work. So from my point of view, I'm a practical guy. I like to do veneers, pressable veneers. I'm not afraid of doing it on the frontal teeth. I get a good result. I know that veneers done on feldspathic materials are probably better, but you achieve a great result also with this material. People are happy, and we are happy. Now, I'm sure that some of you are thinking, you are making it too simple. But I really think that it can be simple. And we already saw today in the previous lectures. It can be very simple if you know how to use the material, to choose the right material, and how to choose the right technique. So let's not forget that the best quality of these materials is translucency. But translucency can also be your best, worst enemy. So, company, they made so many nice colors. So we have many materials to choose from. They all have different translucency, opacity, value, and so on. But let's not forget something very important. When you, as a dentist, prep a tooth, the tooth has a different color then. Sometimes it's darker, sometimes it's really dark. So the goal is to be able to find the perfect match, the perfect balance between the color of the color of the preparation and the material that we have to choose. So if we can find the right balance, you get something that it's already 70% of your work done. Now, how do we get this? Informations. I believe there are 5 parameters that we have to think of. The final color, prep color, gingiva biotype, volume for restoration, and prep design. So that means that we have to talk. Technician and dentist, they have to talk. So, and not just talking, but pictures. It is very important that in the lab we get this kind of picture so we can evaluate if you don't see the patient. Now I have a little example, short, because no time. This is a patient that you can see she has 2 preparation, central teeth. One is a nice color tooth, one is a small, tiny, dark preparation. So as a technician, I choose two different materials. I choose a high translucent material to cover the nice looking color of the preparation, but I use a more opaque material to cover the coloration of this preparation, and also to stop the light to go through too much and have a low value. If you choose the right material, then, as I said before, we can do the certification in a normal way. So the denting first, the incisal, and then the finish work. What I'd like you to show is the coloration. The tooth on top of the dark stamp, it has the same value and luminosity of the tooth that is over the natural stamp. So this is, achieving a great aesthetic success. And you see it on the face of the patient. And I really believe that when you can do something like this, you're not just making a prosthetic work, but you're giving something else to the patient. I believe in satisfaction, self-esteem, improved physical appearance, and better quality of life. So we give the patient more, and maybe we should charge more.